A few days ago, the National Advisory Committee on Immunization provided updated guidance on vaccinations and boosters for people who have had a previous COVID-19 infection. And this is a complicated thing. There is no definitive right answer for what is the optimal time to get vaccinated after you've been had an infection. What we do know from real-world data, and we've said this multiple times, is that at least in the short term, people who've been infected with COVID-19, have had an infection, do generally have some degree of immunity that lasts for several weeks to months. But it is very variable, and we're seeing that more and more with Omicron as well, that people who are not vaccinated can have a very mild illness, and they may not develop both parts of the immune system. So the what we call the humoral immunity, the antibodies in our blood, and the longer lasting, stronger protection you get from cell-mediated immunity. So we do know, it's less clear for Omicron, how much protection and how long it lasts. We also know from immunology and vaccinology and what we know about the expanded intervals that it is important to wait a period of time between doses, and that helps that cell-mediated immunity become stronger and longer lasting. So the guidance really confirms the importance of, even if you have had an infection, that it is important to build up and strengthen your immune system for the long term through vaccination. So if you have not yet been vaccinated and you have been infected recently with Omicron or with Delta in the last few months, you can wait as long as 8 weeks until you start your immunization, dose 1s and dose 2s. Or you can wait 8 weeks between your first and second dose after infection. But what this does is it does mean you will have some degree of risk in that period of time. So it really depends on how much virus is circulating in the community, which strain of the virus it is, and also really important things like who you live with and what risk they might be if you become infected right now. So what we have been saying, what I have been saying all along, is that it is important that once you have recovered from infection and are no longer infectious to others, that you can receive your vaccine anytime after that. If you are somebody who's immune compromised or has risk factors for severe illness, that is when you should get your vaccine. And this applies to booster doses too. So if you are at 6 months from when you've had your second dose, regardless of whether you've had an infection, if you have those underlying conditions that make you more at risk, it's important to get your booster dose right away. If you are otherwise healthy, you can wait as long as 3 months after that infection. So all of this is slightly confusing. I will tell you that we have increasing evidence, and I talked about the puzzle that we were putting together around Omicron. We do know now that that third dose, that booster dose, does increase your protection, probably about 50 to 60% protection from infection with Omicron. So we know now that 2 doses does give really good, strong, longer-lasting protection against severe illness like hospitalizations that leads to hospitalizations or deaths. And that continues. But that can be boosted, and the protection against infection can be boosted with that third dose. So right now, with the amount of transmission that we're seeing, the advice that I give to people is that it is important to get that booster dose at 6 months right now, regardless of whether you've had a mild Omicron infection in the last few weeks. As we get to a place where there's less virus circulating, that advice may change, and it may be prudent or it may be okay to wait a little bit longer. But I encourage everybody, when there's a lot of virus around, vaccination helps. So get it when you recover, whether that's your dose 1, your dose 2, or at 6 months, your booster dose.